Welcome back to another video. So today we're going to be learning how to assist the patient onto the bedpan. A bedpan is a basin used to assist the patient to use the bathroom while they're in the bed. There are multiple reasons why a patient might need to use a bedpan. They may have weakness, they may be continent but not be able to physically or be paralyzed be able to use the bathroom. So if they are still continent, which means that they have the ability to control their bowel or bladder, they can hold it enough for someone to come and help them to get on the bedpan. Those are the reasons why you may have to put a person on the bedpan. So continent, remember, means that I am able to hold my bowel or bladder long enough for someone to either take me to the bathroom or put me on the bedpan. Incontinent means that the patient is not able to hold their pee or their feces long enough for someone to come and assist them. So that patient may be use a brief. We no longer use the term diaper, which is now used for children, and brief is used for adults. So we're going to start the skill. May I come in? Yes. Hi, Mrs. Smith. My name is Wileen. I'm your CNA for today, and I've come to assist you on your bedpan. Is that okay? Yes. May I check your band? Okay, Mrs. Smith, I'm going to wash my hands, get my supplies, and I'll be back. I'm back. You're going to place your supplies that are in the bag on the bed so that you can set up your clean surface. You can use a barrier as a clean surface, or you can wipe your table off with a wipe, a sanitizing wipe, to put your clean linen on, but never put clean linen on a soiled surface. The bag is always used as the separation. I'm going to begin. For this skill, I need 2 barriers, 4 pieces of toilet paper, a set of gloves, and a privacy blanket. I will also need a bedpan, which I will find in the residence room. Mrs. Smith, are you okay? Go ahead and apply my gloves, and then I'm going to put the privacy blanket on them so that I can pull the sheet down so that remains clean, and the privacy blanket will stay on the patient. I'm going to put your privacy blanket on, okay, Mrs. Smith? You want to always maintain your patient's dignity at all times. They should never be fully uncovered unless you're giving care to that part. So now that I have her privacy blanket on, I'm going to pull this top sheet down to assist her onto the bedpan. I'm going to pull your sheet down, Mrs. Smith. And part of the indirect care is making sure I let the patient know what I'm doing at all times. Okay, Mrs. Smith, I'm going to assist you to turn on your side. If the patient is able to sit up, you can have them prop their bottom up, put their pad underneath them in the bedpan, but if they're weak, you're going to turn them like you normally would with proper body mechanics. You're going to assist, put your arm here, Mrs. Smith. Lift your knee, please. And then I'm going to assist Mrs. Smith, turning to her side. Mrs. Smith, can you turn to your side, please? I will put the rail up so that she can hold herself up on that side. In the meantime, she is not uncovered right now. I'm going to put this down as a protector to keep pee and feces or urine and feces off of the bed. I took 4 napkins because I always like to line my bedpan with a paper napkin. And that's if feces gets on there, it's less feces to clean up. So this is just an added protection to keep this device as clean as possible. Infection control is key when passing your state exam. I'm going to put this largest part on the largest part of the body, which is the buttocks. And this part will be closer to the crotch, which will be the area for the vagina and the penis. So you're going to use this part for the front, and you're going to align their bottom, their buttocks here. Okay? Okay, Mrs. Smith, I'm going to place the bedpan under you, and you're going to kind of tuck it down under, like when you were doing turn and repositioning. And you're going to slightly grab the hip and say, Mrs. Smith, lay back, please. And her body should naturally fall to the bedpan. I'm going to have Mrs. Smith sit up into a high Fowler's position, which would be the, I'm going to put your head up, Mrs. Smith, which would be the natural body's position to use the bathroom. Because normally, if you're laying flat, your buttocks is naturally closed. But once you sit up, the passage for your stool to come out opens. So I'm going to put her up more in the toilet position to assist her with toileting. Mrs. Smith, are you comfortable here? Okay. I'm going to step behind the curtain for your privacy, and I'll be back. I'm going to step behind the curtain. You're done, Mrs. Smith? Okay. And Mrs. Smith has alerted me that she's done. In order to take the bedpan from under her, again, if she is strong enough, I can have her sit up, but then it will make it hard for me to wipe. So I'm going to lay her back and turn her on her side. Mrs. Smith, I'm going to lay you back down. Are you okay? Okay, Mrs. Smith, put your arm here, please. Again, she stays covered up. Lift your knee, please. And this time, I'm going to push Mrs. Smith's hip and hold the bedpan at the same time so that the feces and urine does not spill on the bed. Okay, Mrs. Smith, can you turn, please? Okay. And I still have 3 more pieces of napkin, so I can put them on my clean surface here. And I'm going to wipe from the anus up. Put that in here. 2, anus up. 3, anus up. And now I'm going to cover this bedpan with the barrier and remove it from the bed. Okay, Mrs. Smith, can you lay back, please? She is now clean. And I'm going to take this sheet and cover her back up. Are you okay, Mrs. Smith? I'm going to take this privacy blanket out and put it in the soiled linen. Okay, Mrs. Smith, I'm taking off your blankets. Make sure it doesn't go into her face. Roll it and put it into your bag that you had at the bedside. I'm going to grab all of my supplies in one, my barrier and my bed pad, and I'm headed to the bathroom. Everything is contained. I have my soiled linen, and now I'm going to the bathroom. Now that I've arrived to the bathroom, I'm going to put my soiled linen in the soiled linen basket. And I'm going to open up my bedpan and throw that barrier in the garbage. I'm going to grab a napkin and hold it at its widest point. And I'm going to throw this barrier in the garbage. And now I'm going to turn my water on with a napkin. I'm going to take these and the feces and throw it in the toilet. I am going to rinse pour that into the toilet. You never want to pour anything with urine or feces into the sink. This area always stays clean. So that was 1 rinse, 2 rinse, 3 rinse, okay? And so now I'm gonna take a napkin and dry the inside. I'm gonna take another napkin and dry the outside. I'm gonna take another napkin and turn the water off. I'm gonna take 1 napkin and now hold this with a clean paper towel. And I'm gonna take 1 more napkin to open up the drawer because my hands still have to have contact with stool. So I wanna make sure I don't touch anything in the room with dirty hands. So I'm headed to the drawers to put the personal belongings away. I'm back, Mrs. Smith. I'm gonna put your bedpan in the drawer. I'm gonna open the drawer with this napkin to keep any stool or anything from touching the bins. I'll be back, Mrs. Smith. I'm going to wash my hands and I'll be back. I'm back, Mrs. Smith. Now that I've washed my hands, I can now do my exit. Mrs. Smith, do you need anything else? No? Okay. Well, I'm gonna put your bed down for safety. Here's your call light. Call me if you need anything. I'm gonna open your privacy curtain, wash my hands, document, and my skill is complete. Now that I'm done with Mrs. Smith, now I'm gonna document the amount of stool, which is small, medium, or large. I'm gonna document whether it is hard or loose. And then I'm also gonna document the color. The color of the stool tells you a lot about what's going on with the patient. And remember, CNAs are the eyes and ears of nursing. So everything that you report to your nurse is important.